want to live independently in the future, and we, the staff here, are here to help you achieve that. But for that process to occur, we may need to make intermediate steps. Our social workers and occupational therapists here are excellent in finding resources outside the world that may assist you in achieving that. Hey guys, I'm here with Mr. I. Hey guys, I was just showing Mr. I around the facility. I was wondering if you can explain your role and introduce yourself to him in his particular case.
Nice to meet you, Mr. I. I'm Andrea. I have worked with continuing care for 5 years, and this is my 5th month on this team. I understand you've already met with our lead social worker, Joyce. She's the counselor that you have been speaking with and who is also coordinating with your family. So feel free to contact either one of us because we communicate with each other on a regular basis.
Hey Mr. I am Sarah, your occupational therapist, and I've been on the team for about 3 months now. So our job here is to ensure that you're in the right condition to return home and continue with your everyday life. We want to make sure that you're independent with doing everyday daily tasks such as preparing meals, taking a shower, as well as getting around your house.
So not only do we assess your physical function, but also see if we can offer support in other areas that might be impacting your well-being. We want to make sure that you have some form of support when you are released from the hospital.
That's great. Can you guys also talk about your responsibility in discharge and planning?
Sure, doctor. So discharge planning is an extensive process that involves the evaluations from all departments. We understand that every department has an essential role in discharge and patient care. Like I mentioned earlier, our focus here in the occupational therapy department is to measure your ability to function and work at home.
So when beginning discussion on patient discharge, we like to use a step-by-step process to solidify our roles. Number 1 being evaluating our patient's concerns and considering the practicality. For example, it's important to respect your independence and the fact that you like to live at home. So number 2 of the step is to assess your physiological condition with approval by clinicians. Now this is through seeing your physician as well as your physiotherapist to check things such as your blood pressure and mobility. And so number 3 is to find service to continue medical support. We are very concerned about your health inside the hospital and once you leave as well. We will connect with your home care and other resources.
I know Sarah and Andrea has a considerable amount to do. We as a team will support them when they need. This way we can ensure that as a team we're working effectively and efficiently. Does that sound good to you, Mr. I? Are we doing a good job?
Yes, very much. I feel very confident. Thank you.
Oh, hi Jean, how are you?
Hey, you can do better.
Oh, how come? What's wrong? I just completed a pre-occupational therapy session assessment on Mr. I. It seems like he's doing pretty well.
Yeah, I'm just frustrated about all the work I have to do. In addition to doing assessments, I have to chair the meetings because Ryan's always late. Give me a break.
Well, from the assessment, it seems that Mr. I could use physiotherapy at home and minimal assistance with bathing and housekeeping.
It's already been decided. The other physicians agree that the rehab program would be better. It's safer, and his adherence to the program treatment would be better inside the hospital. Can we not talk about it right now? It's my break.
This is my break too. Mr. I has been having sleeping difficulties in the hospital, and if we could work something out so he can be at home so he can sleep better, that would be the best. And I mean, how hard is leading a meeting? Seriously.
Excuse me? You chair the meeting? I don't think you could.
Guys, what's going on?
Oh, hi, Dr. Reynos. It's nothing of your concern. Sarah was just advising me that she feels Mr. I can be ready to go home at this point, but the physicians have all agreed that he would benefit from the rehab program in the hospital and his adherence would be better. So you must be busy. Don't let us intrude on your schedule.
Sarah, something bothering you?
Dr. Wright, these past 3 months have been extremely hectic for me. I've been trying to find guidance from some of the senior occupational therapists, but none of them seem to be available. And I'm trying to voice my concerns to Jean about Mr. I's case, and she's not even listening to me because I'm new. And I mean, based on his assessment, it shows that he can go home with minimal care, with bathing and housekeeping, but Jean is not even listening to me, and she just cares about her own problems.
Is this true, Jean? Look, I'm just trying to enjoy my break, and Sarah comes to bug me with this problem. I don't want to deal with it right now. I'm just kind of I'm having a hard time, on top of all this, having to chair the meetings because Ryan's always gone, and it's such a struggle with all these new clinicians that lack expertise.
Alright guys, Jean, we work as a team, and as a team we need to respect and help each other out in times of need. I appreciate that you stepped up to chair the meetings, and I thank you for that. However, if you're feeling stressed, you need to voice your concerns at meetings and not relay your stress to Sarah. If I hadn't intruded, I would think that our team is working well with each other and on Mr. Invisible's case. Everybody working on the team has a job and should be treated equally with respect. Sarah, I will talk to the 2 senior occupational therapists and we will work something out. Thank you for bringing up your thoughts and Mr. Invisible's case with Jane and Ruth, but you should voice your concerns at team meetings as well. Patients come first, and it's important to hear his concerns and provide him with all the information he needs to be most satisfied in the situation before we make a decision. I will make sure to talk to Ryan and we'll schedule a meeting immediately and address any concerns the team has. As a team, we need to recognize each other's work and contribution to the workplace to be an effective interprofessional team and providing the best patient-centered care. Do we have a clear understanding?
Yes, Dr. Ritos, thank you. I'm sorry, Sarah.
I'm sorry too, Jean.
Thanks to all for attending this week's discharge planning rounds. Unfortunately, we do have a few absences today, but I'll be sure to communicate the relevant topics and decisions with them. This week, we have 4 patients to be discharged from the ward. We will discuss each patient individually. First, hearing from everyone about the status of the patient, and then coming to a conclusion about the action plan of the discharge plan. The first patient to be discussed is Mr. Invisible. Sarah, will you start by telling us about the OT assessment?
Sure, Dr. Wright. Mr. I shows improvement in mobility and strength, and I believe he can return home with some help with basic housekeeping and bathing.
I agree. From what I have seen of Mr. I's progress, he should be capable of most daily living activities in no time.
Thank you, ladies. Jean, what are your findings based on the physiotherapy assessment?
Well, Mr. I has been declining 50% of his physiotherapy sessions. Although he has seen improvements in mobility, I think perhaps adherence to the program would be better in the inpatient rehabilitation care program. My concern is that if he were to be admitted home, that his adherence to the program would decline below 50%. There is a bed available in 10 days' time.
I happen to agree that it may be unsafe for Mr. I to be discharged into his home alone at the moment. However, he's objecting to being a part of the rehab program.
Yes, Ken has brought to my attention several concerns regarding Mr. I's status. Not only is he hesitating to be discharged home, but our observations are that it may be unsafe for him to do so. In addition to missing physiotherapy sessions, he is only eating 50% of his diet trays and refuses to drink anything other than coffee. Additionally, the bathroom floor is wet and slippery after its use, and in terms of assistance at home, not only is Mr. I's daughter unable to help him at his home, he is also unwilling to stay at hers.
Well, it sounds like we're fairly divided on the appropriate course of action for Mr. I's situation. Joyce, what are your thoughts regarding Mr. I's case?
Well, when I informed Mr. I's daughter of our plan to admit him to rehab, she expressed concern that he would unlikely be willing to go. I've been engaging with Mr. I in grief counseling, and I'm sensing from him that his disengagement with physio and his diet and sleep problems may be related to the grief. It's my suggestion that we refer him to a dietitian nutrition just to check it out, and also to the psychologist for cognitive assessment before discharge, but that we continue with grief counseling after he leaves us.
Ken and Ryan, would you be more comfortable moving forward if we were to have Mr. I referred?
Yes, I think we may gain a better understanding of Mr. I as a whole after a psychological and dietary assessment.
I agree. I think this will help us make a better decision regarding Mr. I's discharge process.
I'm glad we were able to integrate everyone's expertise regarding Mr. I's case. I will refer him to the dietitian and psychologist and keep everyone updated.
When I met you in the summer.
3, 2, 1, action.
Are we supposed to be still like that?
Cool.
Wait, I'm really confused.
You're going in. Hey guys, what's going on?
But she didn't say anything.
She doesn't need to because they already said it.
Okay, I'll just be like, I don't think you.
Sarah, will you start by telling us about the OT assessment?
3, 2, 1, action.
No, sorry.
No, no. No, no.
Let's not talk about this right now. I want a break.
Well, you know, it's my break too, so Mr. I has been having sleeping difficulties at the hospital, and maybe we could work out something so that this treatment could be at home and he can sleep better. How hard is leading a meeting? Like, seriously.
What are you